The initial slow spread of COVID-19 throughout Africa helped some countries to start preparing for the inevitable, but a little more than a year into the pandemic, many Africans report a rather devastating effect on their lives and livelihoods. In many areas, people experience a loss of income and food security is under pressure. Since the beginning of the pandemic, a market research and consulting firm, Ipsos, and its partners conducted public opinion polls in the objective of providing African Union member states with real-time information and guidance to reduce the impact of COVID-19 on the continent. We are now joined by Mary Harris, Director and Political Analyst at Ipsos South Africa. Mary, a very good afternoon to you. Thanks for joining us and a warm welcome to SA Today.
Good afternoon, Simphiwe.
When and how was this study done?
This was the third study in this series. We did two of these series last year, and then this one was done from the 13th to the 23rd of February. And all over Africa, Ipsos is ready to go into field again, so we will go into field in June with this particular study again. I think it makes sense that the study is done over a number of years or a number of months, just to also inform governments about the development of issues in their different countries.
So from the data that has been collected, what are you picking up in terms of people's reaction to this pandemic?
Well, as you said initially, it is really that a very big finding that the health and the income of people in Africa is threatened. First of all, almost 80% are saying that they have income issues, that their income is not stable over this period, and about 80% said that they didn't have enough money for food in the last week. And on the other hand, about 40% say they can't get to a hospital, or there's not enough facilities at the clinic, or the doctors and nurses are too busy to help them if they have chronic illnesses. So definitely on the health side and on the income side, it is influencing Africans in a very bad way.
So in terms of collecting the data, it could have been telephonic or door-to-door. I mean, the methods and the means of collecting such data, how fully representative were they?
Well, this data was collected telephonically by cell phone or by landline in 19 African countries. All of them are not, it's not representative of the full population. In South Africa, it is representative of 95% of South Africans, seeing that we have 95% who have access to a mobile phone. But in other countries like Mozambique, it is not so representative, and it is more people in urban areas and the more affluent that are included in the study.
Well, it's safe to say that by now, almost 2 years later after the first coronavirus, the coronavirus, I beg your pardon, was first identified, almost every African knows what coronavirus is and the kind of impact, which it has on families and just about everybody. So what's your understanding on how they feel about wearing masks and taking all the necessary precautions?
Yeah, mask wearing is widespread throughout Africa, and about 2/3 of Africans said that they are wearing masks. What I think is a little bit of a problem is that the two countries in Africa who are the most populous, Nigeria and Ethiopia, register a smaller number of mask wearing than some of the others. In Nigeria and Ethiopia, it is 57% and 56% respectively who say they do wear masks when they're in contact with other people. And in Cameroon, it is only 35%. It is the lowest of all the African countries. The other 18 countries are above the 50% mark. And in a place like Morocco, it is extremely widespread, and 91% are saying that they do wear masks when they are in contact with other people. In South Africa, it is 79%. So I do think South Africans are not doing badly on this count.
I mean, I'm wondering, Mary, those countries and those people in those countries who don't wear masks, what could their reasoning be? And those who do you think that they are wearing such masks as a result of knowing what the virus can do or whether do you think that they're just simply abiding by the coronavirus protocols that have been put in place by the different countries?
Simphiwe, I think the people who do not wear masks perhaps do not have anything that they can use as a mask. On the other hand, I do think there are people who are vaccine hesitant and do not believe that coronavirus is really a threat, and they don't wear masks either. And I also think some of them are just thinking they are not susceptible to get the virus, so they won't be affected by the virus. That can be all the reasons why people don't wear masks. But those that do, and as I said, it is above 2/3 of this African population, not the South African population only, are wearing these masks as a result, I think, of the messages that they're getting. You know, that threefold message that says, wash your hands, keep a distance from other people, and wear a mask to protect yourself and other people.
So how does vaccine acceptance look like in Africa?
Well, that is going up and down, and sometimes last year it wasn't as high as it is now. In a country like Morocco, it is 88%, so which is very high. In South Africa, it is 61%. So all over the continent, again, 2/3 are saying they will get a injection or jab, let's call it that, when a vaccine is available. But I think a big issue is the fact that vaccines are not all over available yet. Places like Zimbabwe has got, Ghana has got, and a few other countries. We know in South Africa, for instance, only about less than 1% of the population has been vaccinated so far, mainly health workers and then elderly people. But what we're also seeing in other countries, in other research we've done, is that in places like the UK or the States, as soon as a vaccine becomes available, then people are more accepting of the vaccine. In other words, the fact that it's possible to get a vaccine really influences people to say, let's do it. And then obviously, when a vaccine is available, there's a lot more information about it. It gets popularized, and there's communication about it and all those sorts of things. So I do think that in the rest of this year, more and more people will get vaccinated, and the vaccine acceptance in Africa, and specifically South Africa, will grow.
And I suppose there are those doubting Thomases who are rejecting vaccines, because they keep on indulging themselves in these theories and unproven and unsubstantiated theories about vaccines and, fake news and disinformation and misinformation as well.
That does happen. We know that there's a lot of fake news and theories around. I think the big thing is that people need to believe in the science. It doesn't help to believe everything you read in a flyer or on Facebook or something that you were told by your best friend, unless your best friend is a scientist, that's fine. But that unfortunately does happen. And that makes it very difficult for, I think, the health authorities as well as governments to get the message out that these vaccines are safe, that you should get a vaccine, that it will prevent you from getting really, really sick with COVID. So those things are extremely important. But I also think that there's still, let's call it a knowledge deficit at the moment. And I don't think all health authorities and all governments are necessarily doing a very good job in disseminating the true facts and the real facts about COVID-19 and telling people what are the issues. Because most people who don't want a vaccine will tell you they don't want a vaccine because they don't know what the side effects are. And I think that is probably one of the issues that can be very easily addressed. To tell people, are there any side effects? What are the side effects? How likely you are to be affected by them? And those things. I think it will remove quite a lot of the anxiety that people might have and the hesitancy that people might have about vaccinations.
Mary Harris, lovely chatting to you. Thank you so much for your time.
Thank you, Simphiwe.